Melissa Lane, Columbus Technical College, CRN 33931. This is my index card. This is my audience members, Jack and Betty. Few experiences in life can compare to the drama of a seizure. Imagine that your 2-year-old child is playing. 1 second he's laughing, and the next second he stops and drops to the floor and begins shaking violently. You call his name, he doesn't respond, and he cannot speak. You realize that your child is having a seizure. A seizure is defined as a sudden episode of transient neurological symptoms such as convulsions, sensory disturbances, and altered consciousness. A convulsion is a medical condition where the body muscles contract and relax rapidly and repeatedly. This causes uncontrollable shaking of the body. A febrile seizure is the most common type of seizure in the pediatric age group, meaning children newborn to 5 years of age. The National Institute of Health describes a febrile seizure as an event in infancy or childhood, usually occurring between 3 months and 5 years of age, associated with a fever, but without evidence of intracranial infection. This means that the child is having convulsions caused by a sudden spike in body temperature. Watching your child have a seizure like this can be very scary for a parent. During a seizure, the child may lose consciousness, shake violently, their eyes may roll back in their head, they may begin to vomit, and they also may have trouble breathing. Most seizures only last a couple of minutes. They can last up to 15 minutes. Even though a seizure only lasts a couple of minutes, it can be very scary, and it can seem like an eternity to the parent. Febrile seizures are not as dangerous as they look. These seizures are usually classified as simple or complex seizures. A simple seizure happens once in a 24-hour period and lasts up to about 10 minutes. A complex seizure usually happens more than once in a 24-hour period and lasts up to 15 minutes. These seizures are caused by fever, usually from an infection. The most common type of infection is the ear infection. The least common type of infection is an infection of the brain or spinal cord, such as meningitis. 1 in 25 children have febrile seizures. Children do not usually have febrile seizures before the age of 6 months and do not usually have them after the age of 3. A child can inherit the tendency to have febrile seizures from their parents. A child that has febrile seizures does not usually need hospitalization. Most febrile seizures do not cause long-lasting effects. Only a small percentage of children have an increased risk to develop epilepsy later in life. Another complication of having febrile seizures is the possibility of having more febrile seizures. Unfortunately, there is no cure for febrile seizures, but febrile seizures can be prevented. At the first sign of a fever, a child that has had febrile seizures in the past, the parent should automatically go ahead and give them a fever-reducing medicine, such as Tylenol or ibuprofen, to go ahead and lower the fever, so to prevent the seizure from happening. Parents can be relieved to know that the Mayo Clinic research shows that children outgrow febrile seizures by the age of 5. I'll sit down and ask my question. Are there any questions?
After the first seizure, do children often have more seizures?
Yes. After the first seizure, children usually do have more seizures. It is possible for a child to only have one seizure, but after the first one, the risk goes up, and after the second one, the risk goes up more, that they will continue to have febrile seizures up until the age of 5. It usually stops at the age of 3, but it can go up to the age of 5. Are there any more questions?
Are the seizures caused by high fever?
No, the seizures are not caused by high fever. The seizures are caused by the sudden spike of a fever. It does not matter how high the fever is or how low the fever is. It's how fast the child got the fever. Are there any more questions?